Peter, I'm going to kick things off with you. We've got some news recently from Europe that we were talking about back in the green room. Maybe you could talk a little bit about what that news is and what it means. And then I want to ask you this question. Endocrine disruption, what is the single issue today that worries you the most about that topic?
Okay. Let me answer in the context of Patrick's comments and the purpose of this panel, health externalities. And I want to remind you, remember what Nora said yesterday? She said when her customers ask her why they should pay more for organic food, and she said, well, would you rather pay me a little more and your doctor a lot more later? Those are about health externalities, okay? The best estimate right now, done about 5 years ago, of health externalities of the use of pesticides in the US is about $10 billion. It was done by David Pimentel from Cornell University. So that's a big number, $10 billion related to the use of pesticides. But when I respond to your question about what's really got me worried, actually that number is likely to be much, much bigger than $10 billion if we get the science right. What happened in Europe yesterday was the European Food Safety Authority, which is related, it's kind of like their Food and Drug Administration. They issued a new standard for bisphenol A, BPA. You all heard of BPA? Well, there's a big fight here, a big fight in Europe about how much is safe. And Europe lowered the standard yesterday, the EFSA, by a factor of 10 from what it had been. But they concluded that at current levels of exposure, it's probably not a problem from food exposure. But they did say there's some experiments underway. We're going to be revisiting this as more information comes out. With respect to what worries me most, if you know anything about how the EPA and the FDA use science to reach regulatory decisions, you know that the tools they use are decades out of date. They do not reflect what's happened in science, in molecular biology, in genetics, in reproductive biology, over the last 20 years, actually a lot longer than that. And so the safety standards upon which every one of us is depending upon today are so far out of date that we can't count on them. And unfortunately, those agencies are kind of stuck. They are unwilling to take advantage of that new science. And I actually a lot of my work is one key piece of that, which is the way that regulatory testing is done to establish at what level is this chemical safe is in the labs, typically industry labs, and the data never are made available to the public. They start at high doses, and they work down to get to low doses where they don't see an effect. Then they say, well, people are different, so let's divide that level by 10. And because kids aren't little adults, let's divide it by another 10. So ultimately, they introduce a safety factor of 1,000-fold between where they didn't see an effect and what they declare as safe. But they never test what is safe. Why is that important? Well, I work on chemicals that behave like hormones, endocrine disruptors. And it turns out that hormones, you ask any endocrinologist, how hormones work, what happens at high doses can be completely different from what happens at low doses, and you can't predict what's happening at low doses from high dose experiments. What we think is going to happen, and we're in a fight right now with the EPA, the National Academy of Sciences just agreed with us, we think that probably dozens, if not more, chemical safety factors are going to have to be strengthened by a factor of at least 1,000, which is going to take a bunch of chemicals off the market, pesticides and other industrial chemicals. That's going to make us healthier. That's going to reduce those health externalities that currently include a range of today's epidemics: diabetes, prostate cancer, breast cancer, ADHD, autism. So the science on all of those disease endpoints is not certain. There are always questions scientists can raise. But for each of them, there are serious links to endocrine disrupting compounds, so serious that the World Health Organization 2 years ago declared endocrine disruption a global public health threat. You can find that on their website. Thank you.